I want to start by just thanking everybody, the organizers of this, David and his crew, the IOM, or the NAM, I'm sorry, for putting together a great day for all the speakers, everybody who attended. Thank you for being here. Even those of you who didn't manage to get a word in edgewise yet, I hope you will before we're done. I want to say that this is an area that PCORI has decided is smack dab in the middle of what it means. They didn't tell us what patient-centered outcomes research really was when we started 8 years ago, but we're pretty certain that this is close to it. So we have funding that continues. We have a little hiatus next year where they decide if we're going to be reauthorized, but we have 3 more cycles of that. The last one will be January 1st, will be announced and due a letter of intent in February. 3 between now and then. 1 opens tomorrow. That includes a section on methods. There are many recipients of methods awards in the room. We're very proud and grateful to all of you, but we welcome more, particularly on topics that you may have heard about or may have started thinking about today. I would just, we also have, very importantly, we have awards related to dissemination and implementation, and we have a particular set of awards related to shared decision making, which is very closely related to this stuff as well. Those go on actually, regardless of whether we're reauthorized in 2019, those will go on into 2020. So pay attention to those awards, awards around shared decision making and awards around implementation, so they're particularly relevant to the last 2 presentations today. I'm going to just say 3 or 4 questions that I heard and then turn it over to our 2 panelists who I'm very grateful to have here today. Questions that I heard or comments that I heard today: more and better clinical data and clinical evidence are just needed. Seth said it most clearly, that he just got to the point and there was not evidence for him. That is the case. PCORI funds those kinds of studies, and so we are looking. We also have 3 more announcements wherein you could do studies that actually do build this evidence. But another question, I think, is how do we modify the clinical research, and particularly maybe the pre-approval research process, so that the trials begin to give us a clue, so we're not hit by new therapies for which there's no evidence to help guide who would actually benefit from it. What is the what's the role of observational data? There's a couple allusions to it today, but my own personal bias is that there's probably a very big role for the very large observational data that many can now muster. What is the important, how do we take this to shared decision making? Probably, as several people have suggested, it's probably much more a question of shared decision making than it is out and out coverage decisions, even in this area of, in this world of treatment heterogeneity. With that, I am going to introduce our 2 panelists. I'm very grateful to them for being here. They both have a connection to PCORI. Dr. Steve Goodman is Associate Dean for Clinical and Translational Research and Professor of Medicine and Health Research and Policy at Stanford. And Steve is also the co-chair of PCORI's Methodology Committee and has been a member since, a founding member of that committee and co-chair for probably at least 4 to 5 years now. Evelyn Whitlock is PCORI's Chief Science Officer and has really led the thinking at PCORI that's brought our presence in this area of treatment heterogeneity to where it is. So we will start. Both of them have said they've got about 10 minutes of comments, and then we should have a good deal of time for questions. But the question for you is, where do we go next? Maybe this was not the most important meeting of the year. Maybe it was the first of a series of meetings which taken together are the most important.